Let's review our Kata board for today. So we'll start with each of these different sections. So radiology, any comments on radiology? I see that the challenge metric is to achieve test and treatment score to 99%, mean by 331. Looks like the current condition month to date is 97.5. So, Leanne, any comments on that? No? This is supporting the colors under the Kata board. The blue, red, and the green support our A3s. So on this side, our right care is blue, the red is right time, and the green is right cost. So each of these colors on each of these Kata boards indicate which of the A3s they're supporting. Outpatient registration, Sergio, to increase outpatient registrations to 23,664. Current condition, we're at 7,653, and our target condition is 7,500. I know
that is actually 1.6% higher than our target, and we're 2%. We have a 2% increase on our budget year to date.
Okay. So far, neither of these are at challenge, right? Okay.
They're all at target.
Sepsis. BPA sepsis utilization at 100% is our challenge metric. Current condition is 100%. So that's the first out of these first three that are at challenge. Falls, reduced fall rate to 3.5 falls per 1,000 patient days. Jana, current condition 7 falls per 1,000 patient days. Is that correct?
Correct. And actually our current condition is 4.7% instead of our target. That's where we are currently.
Can we go ahead and fix it?
Yes.
And what is our target?
Our target is less than 3.5.
That's our challenge.
The challenge is to reduce fall rate to 3.5 falls per 1,000
Right.
patient days. Our target condition is what?
I don't know.
So do we need to erase then the 7 on the current condition?
No, we know that there have been 7 falls this year
Okay, 7 falls. Okay,
per 1,000 patient days.
awesome.
HCAPS. Jen, again, challenge metric is to be 6 out of 6 greater than 90. This is mean, not peer percentile. So it's
Correct.
communication with nurses, response to hospital staff, hospital environment, pain management, communication about meds and discharge information. And this is measured by discharge and not by receipt. So the starting condition was 4 out of 6. Current condition is 3 out of 6 at greater than 90.
And currently we are below 90%. Hospital environment's 89%. Pain management's 82.1, and communication about medications is 84.4 for the 3 out of 6. The other 3 are above 90%.
And those are means, correct?
Those are mean scores
Okay.
by discharge date.
So far we've got 1 at challenge. Upfront collections, upfront and ED collections, target is to increase upfront collections by 5,000 per week. Started out at 3,789. Current condition, January we were at $4,414 as a monthly average, and last week of February we were at 3,173. So we have improved from the starting condition through January. February we're not, so we are not at challenge on that one. These two we're just monitoring, my chart and readmissions. We maintain challenge on both of those. HCAPS, this is increased transitional care. The challenge metric was to be greater than 80%. Current condition is 94%, so it's 2 that were at challenge. And then the master patient flow, this is basically focused on length of stay. Challenge metric is to have length of stay to less than 83.66, and the current condition is at 86.6, so that is not meeting challenge. So out of these 8, we're 2 out of 8 at challenge, correct?
Mm-hmm.
So a little bit of decrease from last week. We were 4 out of 8. Alright, so let's transition from our Kata board, from our Kata update board to our full Kata board for our shepherding group.
What's our challenge?
It will be catastatic if by 3/2/18 BM has realized a positive impact on its patient experience HCAP score and workforce engagement, Kata team development through the utilization of Kata and TWI by 1, improving the health of its boards, 8 out of 8 healthy boards defined as proper layout, accurate information, standardized and documented periodic reset, 2, energizing and engaging its Kata workforce, first and second coaches taking place effectively on all boards. 3, information of any Kata activity is documented, shared with other internal and external teams, and referenced when necessary. And 4 is our Kata team performance is trending toward its challenge 8 of 8.
And our focus process?
It's our Baptist management system, and we want to achieve that by 3/31/18.
And what is our target condition?
Our target condition is under our first block diagram. We want to identify the obstacle to the A30, initiate the Get Better Jump Start with key players, create Kata boards, right players into the right roles, proper selection of leaders and coaches. And then our second block diagram is shepherding team selects the candidates. Candidates observe for 6 weeks. Candidates receive Kata domino training, and then candidates are novice on their own boards. And process characteristics that we have under our target condition is a minimum of 2 PDSAs a week, 1 of which is not a go and see. We want 6 of 6 newly trained Kata staff are observing 3 days a week. Kata teams meet the minimum 3 times a week to have meaningful coaching cycle to improve competency of learner, and then the first coach to update the Kata dashboard. Then our process metrics, we want 2 novice, 4 advanced beginners, 3 competent, and then our outcome metrics, teams that challenge, we want 4. And on our process metrics, our 2 novice, 4 advanced beginners, and 3 competent, we actually monitor that on our shepherding board just by putting beside our learners where we think they fall as a novice, as competent, or advanced beginner. So that's how we track that.
In your current condition, what is your actual condition now?
First of all, we identify problematic areas, connect to our strategic 8-3s, develop the Kata board, assemble learners and coaching team, and then under our block diagram B, we select the individuals, speak to the shepherding team about the candidate, send them to Kata training, and then individuals observe Kata boards. And then our process characteristics is go and see PDSAs have been replaced by hypothesis ones on the majority. 3 of 6 newly Kata trained staff are not actively involved in observing. Teams do meet on their boards unless the coach or the learner are out. And then we have a consistent update of the Kata dashboard. And as you can see, we've been tracking that here. So we've had 5 weeks in a row where it has been updated properly. And then our process metrics, currently we have 3 novice, 3 advanced beginners, and 3 competent. And we've got that explained over on our shepherding board. And then our outcome metric, teams that challenge, we have 2 of 8.
So what was your last step?
My last step was going forward, we will bring all Kata training recommendations to the shepherding team for approval before the staff is sent for Kata training. This will help with making sure that we select the most effective candidates for Kata learners/coaches. This step will ensure that we have more effective shepherding meetings as well.
What did you expect?
I expect that going forward, all candidates for Kata training will be processed and approved by the shepherding team before being sent for Kata training, and will observe 6 weeks before receiving Kata training.
What actually happened?
Last week, our shepherding team decided to add this to our senior leadership meeting agenda. Any candidates will be brought to the senior leadership team meeting, and the shepherding team will decide to send the candidate the Kata to Kata training after discussing the candidates that have been suggested for training.
And what did you learn?
That all Kata candidates should come through the shepherding team before going to Kata training. And we're just going to be observing that as we have candidates come through. We've not had any come through as of yet, but we will be observing that just to make sure that they're following the correct procedure that we've put in place. You want me to do yours now? Okay, so what was your last step?
So, Jana and Robert to discuss process for nursing Kata boards when they are aware they will not be in the building.
Okay, and then what did you expect?
The process will be determined by Robert and Jana, what will be used when they are out of the building or when other priorities hinder the process of completing Kata at least 3 times a week.
Okay, and what actually happened?
Robert and I determined that the process of communication would take place via Outlook calendar. An invite would be sent to the member who would be out of the office to the team member who would be present, inviting them to Kata for the day.
Okay, and then what did you learn?
In order to be successful, the invite must be sent and communication must take place so both coaches are aware of who is going to be out of the building.
And then you have a second one, don't you?
Mhm.
Okay, so what was your last step?
Jana will work with Parker and Preston to determine the date for them to visit within the next 3 weeks to train the nurse leaders on leader standard work. Other senior leaders may attend if they are interested.
Okay, and what did you expect?
That Parker and Preston would set a date to visit and all nursing managers would be requested to attend, and but only one will be open to trying leader standard work.
Okay, and then what actually happened?
Parker and Preston will come 2:21 at 10 a.m. to teach nursing leaders about leader standard work.
And then what did you learn?
I learned that I didn't invite any of the other senior leaders and that one nurse manager will be out at EICU training and will not be able to attend.
So what obstacles do you think are now preventing you from reaching the target condition?
So we do not currently have a good process of selecting learners and coaches, which lead to ineffective shepherding meetings, resulting in slower progress. 6 newly trained Kata staff are not actively participating by observing Kata meetings at least 3 times a week. Thus, they will stay at a novice and will not be prepared as a Kata learner. 4 of 8 Kata boards vary on their meeting time due to meetings or immediate needs and lack of leader standard work, thus creating a potential for relapse of not meeting at least 3 times per week or extended periods.
And which obstacles are you addressing now?
So obstacle 7,
So what is your next step?
Jana will get with nurse managers and reevaluate times to Kata on CCU and senior care due to senior leadership on Mondays during their time to Kata. This also affects newly trained Kata staff when they arrive to Kata at posted times, but it's not being done until later.
Okay, and what do you expect?
New times will be set when the meetings are less likely to be occurring. The hope is that time management and schedules will be better once leader standard work training is completed.
Okay, and when can we go and see what you have learned from taking that step?
2:26.
What obstacle are you addressing now on your other PDSA?
Okay. So obstacle 8.
And what is your next step?
One nurse manager will need leader standard work training after Parker and Preston have done education due to EICU training on the same day. I will ask if education can be done for nurse manager via WebEx on a different date.
Okay, and then what do you expect?
I expect that Parker and Preston will be willing to educate the nurse manager on a different date, so all of the nurse managers will understand leader standard work and it can be utilized to benefit time management.
Okay, and when can we go and see what you've learned from taking that step?
2:26.